Hello, good morning. My name is Ferry Effendi from Department of Pharmacy, Sekolah Tinggi Teknologi Industri dan Farmasi Bogor. I will present my article about analysis of drug effectiveness and efficiency of use of amlodipine-captopril combination compared to amlodipine-valsartan in the ex-hospital patient of Bogor. Hypertension or high blood pressure is a disease that is often found. This disease is also often referred to as the silent killer because it rarely gives signs and symptoms. Hypertension therapy is therapy that requires a long time in the treatment. This causes the patient to be treated longer. For the longer the patient is treated certainly have an impact on the amount of treatment cost to be inquired by the patient. The cost of health service, especially medicine costs, has risen sharply in the last few decades, and this trend is likely to continue. This is due to the increased use of drugs and the presence of new drugs that are more expensive and the application of sophisticated technology. Increasing healthcare costs is increasingly difficult to overcome by the ability to provide government and community fund. Studies that study this are known as pharmaconomics. Pharmaconomics is very important in helping effort to control drug costs, especially in the application of national health insurance, organized by the Social Security Organizing Agency or BPJS in drug selection. The efficiency and safety factor is one important consideration, but economic consideration become very important. The methodology used in making drug selection decisions that are both cost-effective and cost-effective in cost-effectiveness analysis. In general, cost-effectiveness analysis is defined as analytical and mathematical procedure used to assist in choosing an action to be carried out from various alternatives that exist. Various kinds of antihypertensive are used to treat hypertension at X hospital. However, the choice for antihypertensive therapy combination that is often used in hospitalization is a combination of amlodipine 10 mg captopril 25 mg and combination of amlodipine 10 mg valsartan 160 mg. Based on data from January until December 2018 recorded 45 patients who used a combination of amlodipine 10 mg captopril 25 mg and 46 patients who used a combination of amlodipine 10 mg valsartan 160 mg. The effectiveness and cost efficiency of amlodipine 10 mg captopril 25 mg combination and amlodipine 10 mg valsartan 160 mg combination in the management of hypertension in ex-hospital hospitalization is not yet known, so this research needs to be done to find out more effective and efficiency hypertension treatment in hypertension patient treated at ex-hospital BPJS user. This research is an observational or non-experimental research with a descriptive analytic design and in the form of a cross-sectional analysis by looking at secondary data taken from medical record data. Data was collected using a retrospective approach that is using medical record data of hypertensive patients using BPJS and undergoing hospitalization at X hospital during the January until December 2018 period. This study is a pharmaconomic study by conducting a comparative study of the cost of treating hypertension between an antihypertensive combination of amlodipine 10 mg captopril 25 mg with a combination of amlodipine 10 mg valsartan 160 mg and comparing the effectiveness of each of these antihypertensive combination. The calculation of cost is reviewed from the perspective of BPJS on direct medical costs or might or direct medical costs, namely the cost of using antihypertensive drug, doctor service costs, and treatment costs during antihypertensive drug administration. The method for analyzing data used two methods, namely statistical data analysis and pharmaconomic analysis. Data analysis was performed using the statistical package for the SPSS24. In this research, the method used is cost-effectiveness analysis. Cost-effectiveness analysis based on the result of the value of average cost-effectiveness ratio. The data obtained were analyzed for each patient, and the total cost data were classified according to the antihypertensive combination obtained and calculated by Acer, which is the average of the direct treatment cost of each treatment according to their class divided by the percent effectiveness of therapy used using the following formula. Acer equal total of medication cost divided effectiveness or clinical outcomes. Table 1 show that the group of the patient with the most hypertension was at the age of 56 until 65 years, as many as 30 patients or 33.3%. Age 46 until 55 years, as many as 24 patients or 26.7%. Age 36 until 45 years, 18 patients or 20%. Age more than 65 years were 12 patients or 13.3%, and the least were at 26 until 35, as many as 6 patients or 6.7%. This can be due to the increased incidence of hypertension in the age group above 46 years, because with increasing age blood pressure increased due to calcification of the vessel wall, causing reduced elasticity of the vessel wall. Hypertension is more common in male patients, as many as 52 patients or 57.8%, compared to 38 female patients or 42.2%. Apart from smoking habits, from unhealthy lifestyle, this can also be caused by a hormonal difference, because the hormone testosterone is water retention, so the possibility of men affected by hypertension is greater than women. The occupation that suffered the most from hypertension were housewives in 33 patients or 36.7%, followed by entrepreneur in 25 patients or 27.8%, employees and driver in 12 patients or 13.3%, laborer in 9% or 10%. Civil and teacher, as many as 8 patients or 8.9%, did not work, as many as 2 patients or 2.2%, and the last were farmer, as much as 1% or 1.1%. This can be caused by many factors, such as the use of birth control pills. Older eggs cause fewer estrogen hormones, so that they are more at risk of developing hypertension. Patients with the most hypertension were patients with the most recent education, namely elementary school, as many as 30 patients or 33.3%, high school as many as 27 patients or 30%, followed by junior high school, first secondary school as many as 23 patients or 25.6%, bachelor as many as 8 patients or 8.9%, and at least that is not schooling as much as 2 patients or 2.2%. Effectiveness is the success of hypertensive treatment to reach blood pressure level toward the target after the patient gets antihypertensive therapy, Effectiveness is obtained by calculating the blood pressure of patients who reach the target divided by the number of patients using the therapy. Based on the table above, the patient with the most controlled blood pressure were the patient receiving amlodipine-captopril combination therapy as many as 53.8% or 35%, and 10 patients with uncontrolled blood pressure, while patients with amlodipine-valsartan combination therapy were 46.2%, or as many 30 patients are stressed his blood was controlled and 15 patients has blood pressure out of control. This proves that the amlodipine-captopril combination is more effective than the amlodipine-valsartan combination in BPJS outpatient hypertensive patients at X hospital. Data analysis using percent chi-square statistical test process with statistical product and service solution 24 for window products a significant value of 0.039 because P 0.039 less than 0.05 HO is accepted. This means that there is a significant relationship between patients give amlodipine-captopril and amlodipine-valsartan antihypertensive therapy with output or effectiveness. Calculation of direct medical costs for hypertensive patients undergoing hospitalization at X hospital in 2018 can be seen in the table above. There are three components of cost, namely the cost of antihypertensive drug, hospitalization costs, and the cost of care during hospitalization that include doctor fees, nursing care costs, and laboratory costs. The total direct medical cost for using the combination of amlodipine-captopril for 45 patients is 67,786,075 rupees, with an average direct medical cost per patient that is 1,506,357 rupees. Table 4. Illustration the total direct medical cost for user therapy for amlodipine-valsartan combination user therapy. The total direct medical cost for using the combination of amlodipine-valsartan for 45 patients is 63,008,804 rupees, with an average direct medical cost per patient that is 1,845,640 rupees. From the table above show that the unit cost of patients receiving amlodipine-captopril combination therapy is 43,038 rupees. Lower the patient receiving amlodipine-valsartan combination therapy, which is 61,048 rupees. Cost effectiveness research is expressed in the form of answer obtained by comparing the average cost of various treatment patterns with the effectiveness of the treatment pattern to achieve the expected blood pressure outcome or effectiveness. Answer value can be used as a criterion, and intervention is said to be cost effectiveness is the lowest cost per unit effectiveness. In other words, the answer value is the lowest. The answer's value shows that for every 1% increase in effectiveness it takes a cost of answer. For example, in the amlodipine-captopril combination, it means that each 1% increase in the effectiveness of the combination requires a cost of 90,361 rupees based on table 6. The higher ASR value is shown by the combination of the drug Amlodipine-Valsartan, which is 27,655 rupiah, and the lowest value of ASR is the Amlodipine-Captopril combination, which is 90,361 rupiah. The smaller the ASR value, the most cost-effective the drug, so it can be concluded that the combination of Amlodipine-Captopril is the most cost-effective or the efficient drug for antihypertensive therapy in hospitals patient in ex-hospital. Calculation about my article is patient with hypertension where hospital most male sex or 57.8% based on age at most 56 until 65 years or 33.3% based on the most occupation, namely housewife 36.7%, and based on the most recent education, the most are elementary school 33.3%. Outcome or effectiveness on the use of amlodipine-captopril antihypertensive combination that is equal to 53.8%, while the effectiveness of the amlodipine-valsartan antihypertensive combination is 46.2%. This means that the amlodipine-captopril combination is more effective compared to the amlodipine-valsartan combination in hypertensive patients by 46.2% hospital at X hospital. Based on ASR value of amlodipine-captopril antihypertensive combination is 90,361 rupiah, while in amlodipine-valsartan antihypertensive combination is 27,655 rupiah, so that the amlodipine-captopril combination is more efficient compared to the amlodipine-valsartan combination in patients with hypertension in patients at X hospital. Thank you.